I just want to introduce you to our first doctor of the evening, Dr. John Tegzes. Dr. Tegzes is the director of Western University Health Sciences in Pomona. He is a veterinarian toxicologist. He is one of the only few board-certified veterinary toxicologists in the country. Ladies and gentlemen, please help me welcome Dr. Tegzes.
So how many of you in the room own animals? Looks like the vast majority. And I'm going to talk to you for a few moments. I'm going to actually come around this way so I can see you better. But I'm going to talk to you about why you should all be concerned about animal health and how we can work together to try to figure out what we can expect in both you and your animals. So I am a veterinarian, and my specialty is in veterinary toxicology. I've spent the majority of my career studying how poisons affect animals. One Health is a term that analyzes the interactions and the relationships among humans, animals, and the environment. And I spent a lot of my time looking at animal health and helping to predict how some toxins and poisons will ultimately affect the environment and people as well. And so I think it's really important that we look at your animals and that we come up with some strategies to try to prevent some of the health effects. So the animals that we see, and we just heard from our other speakers, that we don't know all the long-term chronic effects that this gas leak is going to have on either you or your animals. There isn't readily available information that points to, well, at this level, we can experience these things in this time frame. If we pay attention to the health of the animals, we'll quickly see that animals have a much shorter lifespan than we do. So if we are anticipating chronic effects in humans in 30 years from now or 20 years from now, that's going to be a year or two in your dog or cat. And so it's really important that we keep a close eye in order to help predict what maybe we can do to help your health as we move forward. There are lots of components to the toxic gas leak. You know that already. We've heard a lot about that. Some have short-term effects, some long-term, and that's what we need to kind of figure out together. We know that methane and its odorants are causing a lot of the signs that you're all seeing with bloody noses. The same exact thing is happening to your animals. The more dangerous thing, in my opinion, are the gases that are heavier than air. Methane is relatively light, it dissipates, but hydrogen sulfide and benzene are very heavy. They tend to settle on the ground in low places, exactly where dogs and cats spend most of their time. And how do dogs and cats explore their environment? Through their noses and their mouths. So anything that's down there, they're going to inhale deeply, and they're probably going to eat. So we need to be very conscious and aware of some of the things that we could expect from them. We know that at high concentrations, some of the symptoms that people experience, like headaches and memory loss, come out in different ways in dogs and cats. They can't tell us when they're hurting. So look for signs of that your pet just doesn't want to be around you, that they hide off in other locations. That sometimes means that your pet's in pain. Likewise, if they don't want to eat, I know my own dogs, they revolve around their food bowl. They want to eat all the time. So any change in appetite is significant, and you should really pay attention to that. Benzene is the other toxic gas that we've talked a lot about, or you've heard a lot about. That's the one that I find most worrisome for the long-term chronic effects because we know it's carcinogenic. And as I said a moment ago, we can really look at our animals to try to see what we can do, what we can find out about them in order to predict maybe some of the things we can do for people as well. So again, just to reiterate some of the things that I said to you a moment ago, changes in appetite, lethargy, all the same things that you've been hearing about tonight. Sleepiness, red eyes, bloody noses, mouth irritation, all important to see. So what I keep getting asked is, what should we do? What should you talk to your veterinarian about? What kinds of things should we be watching for? And I'm going to talk about those. So the health risks are lung disease, suppressed immune systems, infections, neurological effects, cancers, and poor reproductive health. Now, most of our animals are spayed or neutered, and that's a really good thing, but some of you probably have animals that are breeding animals. Maybe some of you have horses as well, where the reproductive health is really important to you. That's one of the things that will also be impacted by the toxic gases, and we need to keep an eye on. So what I'm recommending and what you should say to your veterinarian, I'm recommending that your pets be examined every 6 months. And the things that I would like them to watch for are changes in body weight, and most specifically the size of their lymph nodes. So in order to assess the lymph nodes and the effect on their immune systems, there are certain things that they can do. They can take a chest x-ray every 6 months. What that will do is help to evaluate the airways, but more importantly, what I'm really trying to look for are changes in the size of lymph nodes that are inside of the chest. They should also, when they're doing physical exams, really be examining the lymph nodes throughout the body and looking for changes in size. If they examine them every 6 months, we'll get a nice, be able to track them over a period of time. Likewise, some blood tests and to evaluate their organ function, but even more importantly, and this is something that isn't typically done on a vet visit, but you should ask them to do a blood smear. And that allows them to look at the morphology of the white blood cells and to see if there are any changes from the toxins themselves. I truly, sincerely hope that none of your animals die through this. But if they do die, we need to collect important information from them. What I suggest is that you submit the entire carcass to a veterinarian so that it can be evaluated. What we call a necropsy in veterinary medicine is the same thing as an autopsy. And I apologize that I just used the word carcass. That was insensitive of me. But you do need to submit the entire body. What we normally would like is for that to be submitted very, very quickly so it can be evaluated. But if you're not able to do that, it's important that you wrap the body in aluminum foil and then put it in plastic. And I'm sorry that I'm saying these things, but I think it's really important for us to get information. The reason for that is that plastics contain petroleum products. And we don't want anything from plastic to leach it, onto the body that would interfere with any toxicological analyses that we would perform. So wrapping in tin foil is a good thing to do. We've learned a lot about this through some of the from some of the oil leaks in Alaska and in the South, and how to best make sure that we're getting the right samples. So be proactive, make sure that you're feeding your animals and giving them water inside. You shouldn't be leaving water bowls or food bowls outside in the air. Make sure that you remove the animals from the area of the leak if that's at all possible. I know that's not possible for them all, but they should be living elsewhere. Get veterinary care every 6 months, whether they need it or not, so that we can be proactive in monitoring, and keep really good records of your own. If you notice changes, document them. Keep a notepad, the date and time when you started to see changes. That will become important as well. Wildlife are equally going to be affected, and so it would be important for us to also monitor those. I'm suggesting that we do wildlife counts in the area, either by helicopter or on foot. If you see animals behaving abnormally, wildlife, don't approach them. Do call somebody to come out and take a look at them. And if you happen to find dead birds in particular, again, we don't want you to handle them, but you should call somebody to come and collect them. That would be important information for us to be able to collect. It was really very fast. I know I didn't have a lot of time, but I wanted to give you an overview. And we're not having questions now, right? So.
Thank you very much, Dr. Tegzes. And everyone, he will be here at the end of the presentation if you have questions for him.